Well, sadly, the scenes we've been seeing in India in recent weeks are all too familiar. In the past 15 months, we've seen them play out across the globe in Wuhan, China, in Italy, Brazil, the US and Great Britain. More than 153 million people have contracted coronavirus and more than 3 million have died. It's also taken an almost unimaginable toll on frontline medical workers who've been forced to make impossible decisions to put their jobs first, often with limited protection, putting themselves and loved ones in peril. UK-based palliative care doctor Rachel Clarke has captured her experiences in an aptly named book, Breathtaking, documenting the early first months of the pandemic.
China has identified the cause of the mysterious pneumonia outbreak in Wuhan city.
Among those who died from the illness is Li Wenliang, one of the first doctors to have warned people about the coronavirus.
The virus outbreak has already spread to 20 mainland cities.
I keep scouring the latest coronavirus numbers online. I feel afraid.
A mystery strain of the coronavirus has been detected outside of China for the first time.
The coronavirus has hit the UK.
The people of the United Kingdom are now being advised to make drastic changes.
On the morning of the 3rd of March, I discover quite how much, unusually for me, I have been yearning for authority.
I was at a hospital the other night where there were actually a few coronavirus patients and I shook hands with everybody.
Johnson's reply is so startling, I think I must have misunderstood it. My expletives are violent and unrepeatable.
The UK is on the edge of losing control of coronavirus.
We want you to stay at home. That's how we can protect our NHS and save lives.
The ICU is drenched in COVID. From the throats and hearts and lungs of the patients who lie faceless on their fronts, somewhere in the space between living and dying, the effectiveness of the PPE you wear is unknown and untested. You brace yourself for the worst.
I've today left hospital after a week in which the NHS has saved my life.
Behind closed doors, with neither fanfare nor drama, he's been quietly drowning all night. The act of voicing distress, alerting another human being to his plight, takes spare air he no longer possesses. His lips are grey, fingertips the colour of bruises. And though the oxygen roars, the highest flow we can manage, it's still not enough.
Palliative care doctor and breathtaking author Rachel Clarke joins me now from Oxfordshire in the UK. Thank you so much for getting up early for us. And here we are, 12 months on from those events you were describing, and it really is like a time capsule, your book, taking us back to that moment when you knew what the rest of us didn't know, and that sense of isolation you must have felt, and frustration you must have felt about what you knew and we didn't yet know.
Yeah, absolutely. It was so hard because we this time last year, we were kind of going through a period of awful inertia where doctors knew what was coming. We were watching these horrific scenes on our screens, our phones, from what was happening in China. And then in Italy, in February last year, hospitals started to be completely overwhelmed, running out of oxygen, running out of ventilators. And all the time, cases were going up and up in the UK, and it felt like the government just wasn't doing anything. And we were screaming, begging of the government to lock down the country because we knew that in a week or two, we were going to be in exactly the same position as Italy. And it just didn't happen. You saw that clip from Boris Johnson joking about shaking hands with coronavirus patients. At that time, there were already NHS, National Health Service, doctors and nurses in the UK in intensive care dying of COVID when the Prime Minister was joking about shaking hands with COVID patients.
And you also described that your 9-year-old, I think she was at that point, daughter, a little later on into the pandemic, was saying to you, don't go to work.
Yeah, I mean, I think like everybody in the NHS, I just wanted to be where I could be most useful. The country was being overwhelmed and I wanted to help. And that meant being right in the hospital on the COVID wards, using my palliative care skills there to help all these patients who were coming in. Sometimes they would arrive dead in the ambulance, but those who were still living, help them have as much dignity and comfort as they could. I just had to do that. But when I explained to my kids, my daughter just looked at me and said, "No, I don't want you to die. And why do you care about patients more than us? We're your children. You should love us. You can't do this." And I had to have this awful conversation where I tried to explain that sense of duty. But in the eyes of a 9-year-old, it feels like the ultimate betrayal in a way. And she cried. And I just sat there as she cried because I was, in her eyes, abandoning her. And I don't know. It was the worst moment of all the years I've been a mother, really, because I did feel like I was choosing. And some people, I have friends who spent 3 months living in a hotel room, separated from their children, so that they didn't bring the virus home to them and didn't infect them. And so for them, it was even worse. They literally had no physical contact with their families for months at a time because that's what we had to do to be safe.
Mary, you are an enormous fan of Rachel's. You're also the chief nurse of New South Wales. You've read the book. Rachel talks about the sort of moral injury that she develops from having the PPE and the inability to give that love, or feeling like she had the inability to give that love at the end of someone's life. Can you understand how a mask and gloves and all that get-up would injure someone who's a carer?
First of all, can I just say, Rachel, that I read your articles in The Guardian. I'm so excited. Loved the book, and it made me cry. I'm a palliative care nurse, and so to actually think what it must have been like for you not to be able to look at people, because in palliative care, as Rachel would tell you, we believe that what we do at end of life is so important to give not only the patient a dignified end of life, but also their family, so that everyone can be together. And I have lots of friends who are nurses in the NHS, so I was hearing from them. I had a very dear friend who was in the COVID red zone in intensive care in Liverpool, and I think that moral injury, I hope that you are all able to receive as much support as you possibly can, because well, as I say, it made me cry reading your book. I was heartbroken for you.
Rachel, you write that the patients and their families gave you strength, these moments of light and grace amidst all this death and suffering. Talk to me about those moments.
Well, it's extraordinary because in one sense it was a battlefield. It has been unimaginably horrific to not only be barricaded behind all your PPE, your mask, your visor, but also to have visitors almost entirely banned from the hospital. So a lot of patients were terribly frightened, approaching the end of life, and they couldn't have their mum, dad, spouse, child with them. But what was really remarkable was, in this horrific environment, which is the opposite of what you want a hospital to be like, I can't tell you how brave patients, families and staff were. Literally every day I'd go into work and I would just think to myself, I am seeing the very best of human nature. People are kinder and stronger and more compassionate and more selfless than I ever knew. And I remember one day having to sit down with a patient of mine who had cancer in the hospice and ask him what he wanted to happen to him if he caught COVID. Would he want to go to hospital and be treated, or would he want to stay in the hospice? And that's a tough conversation to have with someone. And he looked at me and he just said, Rachel, if I can stay here, I'd love to. but I do not want to endanger anyone else. So if you want to send me to the hospital, do what's right for the other patients. And I just looked at him and thought, that is what human beings are capable of, that degree of concern and generosity to others. And literally, we have seen that kind of experience every day at work. So I've come out of it, on the one hand, pretty traumatized, like most of us have, but on the other, I feel more hopeful about the future than I did a year ago, because people are good, people are kind.
This must be hard and wonderful to hear, Peter, that your own mother, Nadia, passed away from COVID and you weren't able to be there. Are you reassured by the lengths people like Rachel went to provide that compassion in the last moments?
Oh, yeah, extraordinary. And I would use the term grace, that we see grace in those moments. Look, I think today we've talked a lot about pain as a result of COVID. You know, Rabia talking about pain in her family, me acknowledging there's a hell of a lot of pain around COVID, Mary as well, etc., etc.
And your uncle, I think, has
and my uncle
at the moment.
And my uncle at the moment is kind of on his final days. But again, a graceful moment. So, for example, all 7 of our closest family members are gathered around my uncle right now. I'm not going back, they're there. And the reason they can do that is because they're all working from home. So they can actually go through the ritual, the important family ritual of saying goodbye to somebody as a family. They're doing karaoke together and they're singing songs and they're having a great time and they're having food competitions. And I look at that and I go, you know, COVID in some respects reflects the human experience, that, you know, there is a lot of suffering in the world and it can be a very awful place. But COVID also draws out some of the best in us too, or any traumatic experience also draws out some of the best of us. I do worry about post-traumatic stress amongst our medical community. You know, in New York City, 40% of medical frontline people have diagnosed with some form of PTS or depression. And I wonder about that notion of moral injuries, not being able to differentiate between right or wrong in an emergency department. Oh my goodness.
Yeah.
So let's hope that here in Australia we do enough for those folks.
I want to come to Sam Connor. We're short on time, Sam, and we could stay another hour, couldn't we, in this lovely conversation?
Yeah, we could. I actually don't. You know, I really respect that we're talking about the goodness of the human nature, but I actually want action for disabled people. I know there's a young man named Tom Softly who's 30 years old, hi Tom, who's watching this because he always watches the drum, and he is many times at risk, like the rest of his community, of having, you know, perverse outcomes from COVID. We don't have, as people who are severely at risk, we have people who can't get Pfizer. Tom isn't able to leave his home because he's not able to get a Pfizer vaccine in WA.
So that fear that Rachel is talking about is still gripping.
The fear is,
despite
like,
our golden cage in Australia. Yeah.
Absolutely. And, you know, we have that. I have limb-girdle muscular dystrophy type 2I. The only time I disclose this is on the drum. I don't know why. But, you know, that fear going on to a public transport last year, I remember it. It was just awful. But, you know, there's issues like people in group homes not getting vaccinated. We've got people, we don't have any clarity. We don't have a shielded patients list like they do in the UK. There's a whole raft of conversations and we're calling on government to do those things.
I know you started your life as a broadcaster, Rachel, so I'll chance the last question and tell you have a minute to answer it. Arundhati Roy wrote, the wonderful author, that historically pandemics are portals to another world if we're able to imagine something better. What might be better as a result of this horror?
Well, I think it's really simple. I think that last year what we saw fundamentally was that when it comes to the crunch and when a society, a country faces something catastrophic, we step up. By and large, people step up. They do what is good. They do what is right. And we showed ourselves, I think, in the UK that we were decent. And up and down the country, you know, every village, every town, streets made WhatsApp groups to get shopping and medicines for people who were shielding, for example. We did all of that. And we realised the importance of care. What you need if you're facing death or disability is care from human beings.